Hey guys, it's Doc Heps here with UroCoach. So have you ever been nearly unable to urinate, empty your bladder, and you're wondering, what are some natural ways I might be able to avoid this from happening? Well, we'll go over 3 easy natural ways to help ensure you empty your bladder effectively, at least get you to your urologist. So make sure you stay tuned. Thanks for watching. Lots of guys come in to me and say, hey doc, I'm voiding okay, but occasionally I'll have a lot of difficulty and feel like I'm almost blocked up. There are a few triggers. I'm gonna go over 3 essential things that you need to follow to ensure you empty your bladder effectively, especially if you have some underlying enlarged prostate or BPH. So first off, let's talk about the anatomy, what we're dealing with. Take a look at this diagram. So a few things I think this diagram nicely illustrates. Number one, just the sheer size of the prostate. This is a normal prostate. This is the bladder. The bladder squeezes and pushes urine through the prostatic urethra into the urethra in the outside world. And you can see an enlarged prostate over here. The bladder has to work a lot harder to push that urine through the prostatic urethra to the outside world. Number 2 is the size and thickness of the bladder wall. Normally, the bladder wall should be normal in size, not too thick, and then it stretches out, fills, and empties out nicely. As the bladder has to work harder against the enlarged prostate, the bladder wall muscle will thicken, just like any muscle thickens if it has to work harder. And this can manifest in different urinary symptoms as well, contributing to some urgency and frequency. Lastly, the enlarged prostate can affect the bladder in that the capacity, the ability of it to hold urine is diminished. So the capacity is lower in the enlarged prostate bladder as opposed to the normal prostate. And therefore, it can manifest in urgency, frequency, nighttime frequency, as well as just the mechanical obstruction causing a poor stream and poor flow. Now that we know a little bit about the anatomy, here are 3 ways to help prevent you from getting totally blocked up, having difficulties emptying your bladder. Number 1 is basically avoid constipation. Even though it's not exactly something you think about with the urinary tract, the bowel and bladder are intimately related, although they're not connected. So when your bowel function is not working properly, the pelvic floor muscles are affected, the neurologic function is effective, and the sacral nerves, which innervate not only the bowels, but also the bladder, get affected in a way where you're not able to empty. So a lot of gentlemen come in and they haven't moved their bowels for 5-7 days, and then what brings them into the emergency room is that they can't pee. So what the origin of this is their constipation. And once their constipation resolves, then their urinary function improves. Number 2, make sure you empty your bladder at regular intervals, especially if you have some underlying enlarged prostate. So I always see gentlemen who are on long plane fights, they don't want to get up to go to the bathroom. They over-distend the bladder, and then the muscle is affected in where it doesn't empty. So they get blocked up, they have to go to the emergency room after that long flight and have a catheter placed. So the same thing goes in extended car rides. Make sure you make regular stops, hit the rest areas, just empty your bladder, because if you over-distend that bladder, then that muscle is injured and you may not be able to empty. Lastly are some over-the-counter products, mainly cold and decongestant medications. These medications will have substances in them that make the prostate contract and squeeze, and that can make it more difficult for your bladder to empty. Specific products are called Sudafed, often in cold and sinus or decongestant medications. So make sure you check the labels and talk to your pharmacist if you have some underlying enlarged prostate issues. Hopefully I gave you some insight as to the male anatomy, the pelvic floor anatomy, and what's going on. Make sure you check us out at realurology.com. We appreciate your time. Thanks for watching.